Hello to everybody. My name is Marko Banovic. I'm a cardiologist at the University Clinical Center of Serbia in Belgrade, Serbia. And I'm also an associate professor of cardiology at the Belgrade Medical School and University of Belgrade. Also, I'm the author and the principal investigator of the aortic valve replacement versus conservative treatment in asymptomatic severe aortic stenosis, the AVATAR trial. Well, it is unclear whether the early aortic valve replacement is beneficial in asymptomatic patients with severe aortic stenosis and normal left ventricular ejection fraction. So one intervenes in patients with severe aortic stenosis, in symptomatic patients, in order to improve the patient's quality of life and also to improve survival. And in the symptomatic patients, it's a pretty straightforward decision because it's the only intervention that can improve survival and improve quality of life. However, in asymptomatic patients, the decision is much more difficult because you cannot improve the quality of life because patients are already asymptomatic on one hand, and on the other hand, also the risk of sudden cardiac death is perceived to be low, and which is around 1% per year. However, this rate of sudden cardiac death of 1% per year, or even more, is higher than in general population. And also during the watchful waiting period in patients with severe aortic stenosis, there is a chronic pressure overload of left ventricle, which might lead to the functional and the structural changes, which might already be irreversible at the time of the possible intervention.